All right, saying a couple more things about the source filter theory. Another example is a trumpet. If you've ever played with a trumpet, or if you play the trumpet, there's the mouthpiece, that is this little brass piece that you put your mouth on, and it comes apart from the body of the trumpet. And if you just blow through the mouthpiece itself, you get this sound. That is the noise that you're putting into the trumpet, the raw sound. That's the sound source. The body of the trumpet is a series of air-filled cavities that you change based on how you key the trumpet. So that filter, that is the body of the trumpet, selects out those tones from that raw noise that you put into it. So in the case of the trumpet, the sound source is that turbulence you make at the mouthpiece. And the filter is the body of the trumpet. So your vocal tract performs much in the same way in the production of phonemes for speech. In the case of vowel production, the sound source is the voice. You change the resonant frequency of the oral cavity by changing your tongue position within the oral cavity, and that creates different vowels. For voiceless consonants, the sound source is the point of constriction within your oral cavity where the friction is created. So if it's an F, then this is the point of constriction. If it's a sh, then the point of constriction is back between my tongue and my palate. So that point of constriction is the sound source that is then shaped by my vocal tract. So now let's get into the bones of the face. So to begin with, we're going to start with your jawbone, which is the mandible. When you're born, the mandible is actually a paired bone, meaning you have a right and a left. But as you age, it fuses at midline by age 1. If we look at that point of fusion between the two halves of the mandible, that point is known as the mental symphysis. And then you can see this little dimple here. So that is a full-on hole in a real skull. And that is known as the mental foramen. And you have one on each side of the mandible. And it is through that hole through which a nerve exits to innervate the muscles of the face. So, looking at our skeleton here, you can see the mental foramen. You can see that is quite a significant hole in the mandible. Also notice the U shape of the mandible. So mental symphysis, mental foramen, and this portion of the mandible is known as the corpus of the mandible. And the point at which the mandible changes direction and projects superiorly and becomes this wide flat bone, that angle is known as the ramus of the mandible. So this is the ramus, R-A-M-U-S. And the ramus has 2 points, 2 projections. It has back here the posterior projection that is known as the condylar process. You can see when this guy opens and closes his mouth, the mandible is articulating with the skull at the condylar process. So the condylar process articulates with the skull, and that is at the temporomandibular joint. The anterior process, this is the coronoid process right here, that provides a point of attachment for muscles of the mandible. If my finger was a muscle, you could see how it would contract and it would pull the mandible up. So that's the mandible. The mandible is your lower jaw. What is sometimes referred to as your upper jaw is the maxilla. And this is the bone. Here you can see it yellow. That makes up most of the hard palate. So the roof of your oral cavity, the floor of your nasal cavity. It contains the upper dental ridge, which houses the teeth, your upper teeth, your maxillary teeth. And this is a paired bone, meaning you have a right and a left. So you have three processes of the maxilla we're going to talk about. The first is the zygomatic process of the maxilla. And this is that branch of the maxilla right here that reaches out to articulate with this bluish purple bone right here, which is the cheekbone. So if you put your finger right here on your cheekbone, that is your zygomatic bone. We're going to get to that in a minute. But the part of the maxilla that reaches out and articulates with the zygomatic bone is known as the zygomatic process. We used the term alveoli a couple sections ago when we were talking about the alveoli of the lungs. But the sockets in the skull in which the teeth fit are referred to also as alveoli. They're referred to as the dental alveoli. So the maxilla have what is called the alveolar process. And this is essentially that portion of your maxilla that has the holes in it, the sockets, the dental alveoli, in which your upper teeth are. Also, let's mention the frontal process of the maxilla. So we're going to get to this as well, but the forehead bone is referred to as the frontal bone. So that part of the maxilla that reaches up to articulate with the frontal bone is known as the frontal process of the maxilla. So alveolar process, zygomatic process, frontal process of the maxilla. All right, now taking a look at the hard palate here. So this portion that I have outlined in blue here, that is your hard palate. That is the anterior 2/3 of the hard palate, and that is formed by the maxilla. The point of fusion between the right and left maxilla along the middle of your hard palate is referred to as the intermaxillary suture. That posterior 1/3 of the hard palate, which is right here, that I'm coloring with the red, that is made up not of the maxilla, but that is made up of the palatine bones, and I'm going to get to that in a minute. But to point out to you, the hard palate, so the roof of your mouth, the anterior 2/3 is the maxillary bones or the maxilla. Posterior 1/3 is the palatine bones. You also have sutures in front of the intermaxillary suture, which is called the premaxillary suture, right here. Problems that occur in development of the face of the baby in utero at the premaxilla or along the intermaxillary suture. If those sutures fail to close, then you're talking about different forms of cleft palate. And children that are born with cleft palate have a lot of speech and swallowing problems. So as SLPs, we're highly involved in that. But in the United States, most of the babies that are born with cleft lip and palate get surgical intervention at a very early age. Which means that if you work in the school system, you're probably not going to see those kids, those cleft lip and cleft palate kids, in therapy. But if you work in a children's hospital, you're probably going to see cleft lip and cleft palate kids because they're coming in for those early repairs. And especially in like when they're infants, if you have a cleft lip and a cleft palate, that baby can't wrap their mouth around and get a suction on a bottle or on the breast. So they have trouble taking food. So as the SLP, we're highly involved in that at that level. If it's after the child has developed speech, then we're also involved in teaching that child how to approximate correct phonemes as much as possible before the surgery. And then after surgery, we're in charge of teaching that kid now how to correctly articulate the phonemes with his new and different anatomy that he is not used to. Also, let me say that whereas in the United States, in Europe, we tend to get to those kids with cleft lips and palates very early on and get them repaired surgically. That doesn't happen in most other countries. So if you guys are familiar with Doctors Without Borders, there's a similar operation called Operation Smile. And this is when what we call a cleft palate team, which is surgeons, nurses, dental specialists, speech therapists, travel to countries on volunteer trips, and the doctors provide free cleft lip and palate repairs to children and adults. And the SLPs go along and we evaluate the individual's speech and swallowing before surgery, after the surgery, and do our best to help those individuals going through those changes as much as we can. And you can go on to the Operation Smile website and see lots of emotionally moving examples. So here's a couple little girls with their clefts before, and then you can see them after their repair.
الناس كانوا كيتعاملوا معايا بحال شي وحده غريبه، كيشوفوني يقولوا شوف هذيك. ما كنتش كنتخيل ان كاين شي مستقبل كاع، ما كانش عندي شي مستقبل بحال كاع البنات. عندي شي واحد المره جربت انني نمشي وقدام كلهم حاضيني ومستغربين، شوف هذيك تما ما قدرتش ندخل انايا المدرسه كاع. احاسيس غريبه كان كيسحب لي، واش غير انا بوحدي انا عندي هذا المشكل، ولكن مني شفت بزاف بحالي ماشي غير انا بوحدي وليت بحال واحده منهم، بحال اخوتي.
The next bones we're going to talk about are the nasal bones. So if you take your finger and you set it right here on the bridge of your nose, you are touching your nasal bone. So looking at this image here behind me, you can see that little piece of bone right there labeled nasal. You can see that it articulates superiorly with your forehead, which is the frontal bone. You can see that it articulates laterally with the frontal process of the maxillary bones, or the frontal process of the maxilla. So the nasal bones make up the superior nasal surface. And here's sort of the maxilla and the nasal bones broken apart. And you can see the nasal bones on this model right here. They are the two purple ones. So this is a paired bones, and you have two of them. And if I tilt it up, you can see that the nasal bones make up the roof of part of the roof of the nasal cavity. The anterior roof of the nasal cavity.